the other group.
Is Jeff Redfield from the American Red Cross South Central Ohio, and he's here to present on the Fighting Cancer in Pickaway County project.
Good afternoon, good to see everybody. Thanks for having me. A lot of slides, but I'll go through quickly. If you're not familiar with American Red Cross, our mission: prevent and alleviate human suffering in the face of emergency by mobilizing the power of volunteers and the generosity of donors. She said, I'm Jeff Redfield. I'm a regional philanthropy officer. I work predominantly with foundations in our region, which is a 47-county region. The chapter, the South Central chapter, is one of 5 in our region, and there are 10 counties. Our executive director, Matt Riddle, our biomed account manager, our donor rep, Jessica Hayden, and we are 90% nationally the American Red Cross. What we do, 90% of our workforce is volunteers. We're very small staff. 94% of the work that we do in chapter humanitarian services is volunteer, and biomed is 80% volunteers. There's that 20%, I don't want to volunteer taking my blood. I don't know about you, but that's part of that. Our mission every day, we're out there, we're saving lives. Every 2 seconds, someone in the US needs blood. Every 2 seconds. And it could be a patient battling cancer or heart disease, a child fighting sickle cell disease, mother giving birth, babies born prematurely, or people recovering from accidents. What's interesting is a person who is in an auto accident could need up to 100 units of blood if it is a severe crisis situation. We're always there. We provide 40% of the US blood, more than any other blood bank. The next closest is only 12%. And blood service is an irreplaceable part of our nation's healthcare infrastructure. It is the health and well-being. Without it, we can't. I don't know if I have it on here or in the materials I provided. Nothing can replace blood, the need for blood, other than donated blood. Technology's come a long ways, but not that far. The impact that we make, we did last year in FY21, so July 1st of 2020 through June 30th of 21, we did 83 blood drives in Pickaway County. We had 21 volunteers help us, providing 746 hours of volunteer service. Those 83 drives resulted in 2,764 donated units of blood. That means almost 8,300 lives were saved locally by the donations provided. Not that those all lives are here, because this is a national network. But what was also great about it was the 327 first-time donors. And the key to first-time donors, we have a rare blood directory. 1 in every 1,000 people have the type of blood that is so rare because of antibodies, that is so crisis-related. So the only way to grow that rare directory is first-time donors. So the more first-time donors we can get, the better. So fighting cancer with life-saving platelets. Platelets are what's critical when it comes to fighting cancer. Every 30 seconds in the US, somebody needs platelets. 2 seconds blood, 30 seconds platelets. And they are predicting that cancer cases are going to increase by 36% by 2040. I wish that's something we could do about. Not today, hopefully. 40% of the adults in the US are impacted by cancer. They will be diagnosed with cancer sometime in their life, 40%. And although it's in children it's rare, it's a leading cause of death in children. And think about it. How has cancer impacted your life? I imagine if I asked everybody here has lost somebody, knows somebody. When the situation crisis occurs, somebody in your family, you're like, what do I do? How can I help? Well, this is one of those programs that can help. The platelets are used because when they're getting treatments for fighting cancer, they replace damaged platelets. It's helping them strengthen themselves when they're fighting cancer. And only donated platelets, again with blood, only that can be used when platelets are lost during the cancer treatment. Platelets have a very short specialized use. They take additional equipment. And the delivery really, because they have a short life, you'll see some other things coming up about why that was critical. Nationally, the American Red Cross invests $187 million a year in fighting cancer. It is by far the one disease that blood makes the biggest difference toward. So let's talk about the cost of a blood drive. $3,900 is the average cost. And it breaks down donor recruitment and marketing, medical other supplies, the power red equipment, the blood vehicles, and the staff for $3,900. That's the national average pre-COVID. We know it's going to be going up. We still haven't been measuring that because of additional PPEs, some of the other things. And 25% of that, or $975, would be the equivalent of fighting cancer. If 25% of the blood drives result in the product, that's where that number and that figure comes from. So we're asking you to give to save lives. By doing 975, which would be the fighting cancer portion of a drive. We're asking for 1 drive a month. Do that 975. It'll help us raise awareness, and there's several other goals why we asked for that. We're in a critical crisis with blood in our society, in our community, as well as nationally because of COVID. You know, even during the crisis, because of how much blood is used in different ways, that need never dropped below 80%. So 25%, $3,900 of that, $975 or 12 months, that's the total of the request for 11.7. What it'll do, it'll increase awareness. A lot of people have no idea that blood supports the role it does in fighting cancer. It'll help increase units by 5%. We're trying to get donors to give more often. You can give 6 times a year, but the average blood donor only gives 1.8 times. Lapsed donors. People give and they stop giving for whatever reason, so it'll help us recruit that. I talked about new donors and volunteers. The awareness of this, a lot of people want to help. How do I help? If I can't give blood, maybe I can volunteer, or I can do more. Thank you. Additional benefits, there are 6 benefits, and it's in the materials about giving blood. So it's not only to the people who are going to benefit from the blood helping fight cancer, but the donors actually have other benefits. It's a local impact. Consider somebody here in Circleville battling cancer. This donation might save their life. It might save the life of somebody out west. Somebody in Michigan, Maine, or Montana may be the person that's giving the donation that will save your loved one, your friend, your neighbor, your family member. So there.